How's it going, guys? It is 4:10 a.m. Monday, July 25th here in Japan, and we have a pass level question for Pharm for step one. So before we get started, please subscribe to my channel. I really appreciate it. Give the video a like. I really appreciate it. Find me on Instagram at mehlman_medical, mehlman_medical. Links down below. Find me on Telegram. Links to the Telegram group and channel down below. Now start the clip. 16-year-old boy brought to the physician by his father for a 1A history of rash on his face and arms. He had a soccer tournament 2 days ago. 2 weeks ago, he began taking an oral medication for acne, an agent that inhibits which the following is the most likely explanation for these findings. Let's just whip through the answer choices here. Choice A, dihydrofolate reductase, wrong fucking answer. This refers to methotrexate as well as pyrimethamine and trimethoprim, okay? Look, we can do a 16-minute discussion of all of the medications, all their uses, all their side effects, etc. Methotrexate, you should just know, is first-line DMARD for rheumatoid arthritis, causes pulmonary fibrosis, hepatotoxicity, mucositis. Trimethoprim, just used for simple UTIs with sulfamethoxazole, and pyrimethamine used with sulfadiazine for the treatment of toxo. Wrong fucking answer. Choice B, dihydropteroate synthase. Wrong answer. This is actually sulfonamides inhibit this enzyme. Okay, it's part of the folate pathway. I have never seen this mechanism of action assessed. Very interesting / peculiar, actually, the fact that sulfonamides are so exceedingly high yield for USMLE step 1 and 2, knowing about sulfa allergies and treatments, etc., but yet they do not assess the mechanism of action. Okay, wrong fucking answer. Choice C, histone deacetylase. Wrong answer. This is actually inhibited by valproic acid. I have seen this in a Pharm question on one of the offline step 1 forms, okay? They mention in the vignette, they say valproic acid, which inhibits histone deacetylase. They say that as part of the question, okay? And if you Google this, you'll see that valproic acid inhibits histone deacetylase. Point is, wrong fucking answer. Choice D, microtubule polymerization. Wrong answer. Refers to a myriad of agents, of course, vincristine, vinblastine, colchicine, griseofulvin, the bendazoles, not azoles, bendazoles like albendazole, mebendazole, anti-helminth agents. And of course, paclitaxel, docetaxel, the taxanes prevent microtubule disassembly. Okay, they hyperstabilize the microtubules. Wrong fucking answer. Choice C, transcription. Wrong answer. So DNA polymerase, so transcription is DNA to RNA, translation, mRNA to protein. So if we inhibit translation, if we had a DNA polymerase inhibitor, for instance, that could refer to acyclovir for HSV 1 and 2, as well as VZV for shingles. Could also refer to ganciclovir for CMV. Wrong fucking answer. Choice F, translation, is the correct answer. So obviously we have a myriad of agents. Okay, we have 30S, 50S inhibitors. This is referring to tetracycline antibiotics. Okay, inhibits 30S, prevents the amino acyl tRNA from binding to the A site. So when we treat acne, we first use topical vitamin A compounds such as tretinoin, not isotretinoin, topical tretinoin, followed by topical benzoyl peroxide. Patient can also, if that doesn't work, you can use topical clindamycin. But if we commence an oral antibiotic, it's going to be oral doxycycline or oral tetracycline classically. Nearly identical question shows up on one of the offline nbme exams for step 1. You need to know that tetracycline antibiotics can cause photosensitivity, exceedingly high yield. Now you could say some astute students might remark that, wait, but don't topical vitamin A compounds for acne, don't those also cause photosensitivity? Yes, but that's not part of the question here. I mean, we clearly make it about the oral medication and the proximity in time, okay? So yes, topical vitamin A causes a rash, photosensitivity, but so does oral tetracycline. Last resort for acne being oral isotretinoin. Of course, that's teratogenic. You have to do a pregnancy test prior to commencing it, and recommend barrier contraception if they make it a communication type of question. You know the deal. I'm going to make more content. If you like my stuff, subscribe to my channel. I appreciate your time. That's it.